Good morning, student. I am your Shipra teacher back with a new chapter of civics, that is role of government in healthcare for standard 7. Children, in this chapter we will study about our health, how we will take care of our health and who all are the people who are involved in this taking how they will take care of our health means the role of government in the healthcare. So first of all, we will see in this slide, in the next slide, that is what is health. What is health means first we have to understand the meaning of health. It means our ability to remain free from illness and injuries. Means when we are free from illness, free from injuries, then we will called as healthy. But as we know, all the time we will not remain healthy. Sometimes we fell ill. So what are the causes, what are the factors which affects our health? For example, living in unhygienic condition, without access of clean water, and not get proper or healthy food. So in order to prevent and treat illness, we need proper health care such as health centers, then hospitals, then ambulance services, blood bank, then qualified and experienced doctors and nurses, health workers and other health professionals, medicine and medical equipments that are necessary for treating patients. All these are the requirements to keep ourselves healthy and to treat our illness. Now next topic of this chapter is healthcare services in India. So first of all, we will see India has the largest number of medical colleges in the world and is among the largest producer of doctors also. You can't imagine, children, that approx 30,000 of new doctors qualified every year in our country itself. India is the third largest producer of medicine in the world. Then the number of healthcare facilities has grown considerably in the year. In 1950, there were only 2,717 hospitals in India. But in 1991, there were 11,174 hospitals. And later in 2000, the number grew to 18,218, and till 2014, it was around 35,000 hospitals in our country. Beyond all these development and facilities, there were some drawbacks also. So first drawbacks is that being India is the largest producer and largest medical colleges in the world and produces at least every year 30,000 of doctors qualified every year. Then also most of the doctors prefer to work in urban areas, and hence the rural areas have less doctors. So 21% of communicable diseases are born with water. Means maximum diseases, communicable diseases, are water-borne diseases. The availability of clean water is an issue due to the presence of or the increasing population. Then about half of the total population of children in India are under malnutrition with lack of food to eat. About lakhs of people die from tuberculosis every year, while 2 million cases of malaria are reported every year. Now I will show you some pictures in the slide how the government or the doctors, nurses taking care of the patient. In the first slide, a nurse is taking care of patients, then doctor, then there is a scene of a inside hospital, then there is a picture of blood bank. Now next come to the next topic of this chapter, that is types of healthcare. Children, do you know how many types of healthcare is there? There are two types of healthcare services. One is public healthcare services and another one is private healthcare services. So I will show you two pictures here. One is from our own city, that is one is public healthcare services. This is MGM hospital, picture of a MGM hospital, and another one is the picture of private healthcare service, that is TMH. So now we'll see and study in detail about these two types of healthcare services. First is your public healthcare services. What is this? This is the service which is governed or produced or provided by the government itself. So public health services is a chain of health center and hospital run by government. One important aspect of public health is that it is meant to provide quality healthcare services either free or of low cost, so that even the poor can seek for treatment. Next, now we will see the services of government at both the level. At rural level, at this there are healthcare centers where there is usually a nurse and a village health workers. They are trained enough to take care of common illness and work under the supervision of doctor at a primary health center, that is also known as PHC. Next, at your urban level, that is at town level, there are many government hospitals which have facilities of advanced and specialized treatment. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities to all. In the next slide, I will show you some pictures of the public health service of urban areas. See, these are the pictures of public health care services in urban areas. Now we will come to the next healthcare services, that is private healthcare services. It is the service which is owned by a personal person or by a business organization. So what is this? We will see in this. Many doctors have private clinics. As we can see in our town also, there were so many numbers of clinics in each and every area. In rural area, registered medical practitioners are there. They are also that is also known as RMPS. In urban areas, specialized services are there. Medical shops are there. Every clinic, private clinic, have their own medical shops. Then we have not controlled by the government. This service is not controlled by government, as we have already discussed. It is owned by a single person or by a business organization. Costly than that of the public healthcare services. It is costly than the public healthcare services. Private healthcare services are those services which are owned by a single person or by a business organization. It is very costly, because of which poor people can't afford it, and they will not get the treatment in these. Now we will see the healthcare and equality. Private sector is confined in urban areas, means private clinics mostly found in urban areas, not in rural areas. Incorrect practices are done in the private healthcare services. Only 20% can afford medicine when ill, very costly as compared to the public. It is very costly as compared to the public services. 40% admitted patients have to borrow money from others to get their treatment in private healthcare facilities. Doctors prescribe unnecessary medicine, injections or saline bottles when tablets or simple medicine are enough. Many people are unaware of the medical facilities available in their area. Even so many people are still there who don't know the facilities provided by the government in their own area. Now we will see the issues of the government that he has to look into it. First, the responsibilities of the government to make aware of the facilities to each and every people. How? By advertisement, isn't it? Equal health care to poor and disadvantageous. Health depends on basic amenities and social conditions of the people. So government has to take care of these things. Then condition of public health care centers should be improved so that poor people do not need to go to private clinic and hospital. In urban areas, government must keep a check on the private nursing homes so that there will be no incorrect practices took place. Children, in this way we finish this chapter, and today that's all for today, children. Thank you. Goodbye.